You are in the meeting now. There are 4 participants in the meeting. This meeting is being recorded. You are muted. You can mute or unmute yourself by pressing. You are unmuted.
All right. Good afternoon, everyone. It is Friday, May 1st, which is, I cannot believe it's May. I guess it's May Day. So happy May Day. It's a bit of a cloudy day here in Scranton, but that's okay. We're persevering through a lot right now, and a few clouds aren't going to dampen our spirits. So thank you all for tuning in, and thank you all for participating in the Heart of Scranton fundraiser. It's still going until 7 p.m. Remember, we are directly funding the food banks, Friends of the Poor and Meals on Wheels, to help get food on the tables of our neighbors. We have seen so much generosity. We're at over $62,000 raised since noon yesterday, and we're still going through 7 o'clock today. So if you want to give, it's safdn.org/Heart of Scranton. Special thanks again to the Scranton Area Foundation, Laura Duchessi and her team, and the Weinberg, Moses, Geisinger Foundations, and also Manuka Subaru for those matching dollars. So we're at 62,000. We'd love to get up to that full 100,000 so we can double it to 200. So thank you very much, everybody. I am thrilled today that we are joined by Department of Health officials from down in Harrisburg. We are so lucky to have Deputy Secretary Ray Barishansky and Director of Intergovernmental Affairs Meaghan Abbott. Deputy Secretary Barishansky and Meaghan, thank you for being here. We do have some questions for you, I know, from the community, but we'd love to hear from you any updates that you have for us from Harrisburg. And before we get into that, though, just a deep gratitude for all the hard work that you've been putting in. I know it's been tough as a mayor and as a city hall. Our team has been working around the clock. I can't imagine what it's been like to be in your shoes, and we appreciate you being on today to speak to the City of Scranton.
Great, thank you. So our case totals will be changing again today. Dr. Levine will be giving her press conference around 2 o'clock, I believe we're scheduled for. She'll be with the governor today to be discussing some reopening policies and some thoughts on what counties might be reopening. So that'll be a big announcement today from the secretary. As we reopen, our thoughts here at the department are that we really want to continue to be methodical and thoughtful and science-based as we're going through these steps. And we just want to encourage people, as Dr. Levine reminds everyone every day, that social distancing is very important, washing your hands, wearing a mask when public, all of her daily reminders that she continues to remind everyone that those are still important even as counties begin to open.
Right.
Hear me okay. I want to jump in from and let the general audience know. The Department of Health has been activated on this for approximately 2.5 to 3 months. We are operating out of a command center here at the Pennsylvania Emergency Management Agency, and we are in constant contact with partners on all levels. So from a federal level, we're consistently speaking with Health and Human Services, we're speaking with the White House, and we've spoken with the CDC. In addition, on a level here, we've dealt with the Department of Human Services, Department of Aging, Pennsylvania Emergency Management Agency, as well as a lot of other agencies, including Community and Economic Development, the CED, and others, to assure that we are pushing out the health aspects of all policies in as much of a prudent manner as possible, but also let people know that we also communicate with our county and municipal health departments, as well as the Hospital and Health Association of Pennsylvania, or HAP. Realizing that I don't want to go on too long, but I do want to leave time for questions from your audience. So I did want people to know some of the things that we're doing.
No, thank you. That's really helpful. And as as we've been talking about, as I've been talking with, the Department of Health and my emergency management coordinator, my fire chief has been in touch. I know at the county level as well, we've had good communication with the Department of Health, and so have the hospitals and nursing homes. But I wanted to make sure that our community knows that as well. Deputy Secretary, would you mind explaining what HAP is and what how HAP might be communicating with the hospitals, the nursing homes, and the Department of Health?
Of course. Please tell me if you can hear me okay.
Yeah.
I will let you know that the Hospital and Healthcare Association of Pennsylvania actually counts among its members all of the acute care hospitals in the Commonwealth. And one of the systems that we have set up here is we have various HAP representatives here at the Departmental Operations Center. There's a lot of experience in HAP in regard to emergency preparedness, specifically in regard to hospital emergency preparedness. So they act as our partners in regard to our emergency response with hospitals. And obviously, in this particular emergency, this particular public health emergency, our communication with our hospitals is extremely important. We want to know what their PPE needs are, their personal protective equipment needs are, including N95 masks, which I'm sure everybody's seen on the news, including things like hospital gowns and shields and gloves, as well as their hospital bed capacity, which is something else that we monitor on a daily basis, acute care, intensive care unit, bed availability, and things like that. So during mass emergencies like this one, HAP works hand in hand with us in regards to those needs.
Yeah, that's really useful to know. I think sometimes up here in northeastern Pennsylvania, we've had some unfortunately, some of our nursing homes have seen some pretty bad outbreaks, and so it's good to know that the Department of Health that has been in touch with these homes and with us up here, and of course with the hospitals. We are so lucky to have the hospitals right here in Scranton, Moses Taylor Regional, and of course Geisinger. So we know that we're lucky, but I just want to make sure everyone knows the good work that you all are doing. We do have some questions for you if you can help us answer. So I'd start out by saying, and I know that you all know this better than any of us, that the city and the county here, we don't have health departments, so we haven't had access to as much of the data as we would have liked. Do you see, I know that there's a Senate bill that went out of committee, but over the time as we look to combat this virus over the months and before there's a vaccine, even a year or two, do you think that we might be able to get more data about the different cases so that we can better plan here at the policy level, at the city level?
So I will let you know that I think data is one of the areas where we get questions from a lot of different municipalities on. And one of the things that we've tried to do at the department is really stay on top of all of the data in regard to the Commonwealth with the Secretary and the Governor's daily briefing. Yesterday I was on a phone call with the county, and they asked if those briefings were going to be discontinued. I said, no, that's actually one of the ways that we try to communicate with everybody in as a comprehensive manner as possible. And Dr. Levine, I believe it's typically at 2 o'clock, but Dr. Levine, the governor, and we try to push out as much information as possible. Meaghan wants to add on to that. So
thank you.
So when you go to the Department of Health's website, our coronavirus page, there is a button that says PA data. And there's a significant amount of data on on that page. It also includes links to where you can find zip code level data, as well as trajectory animations, which are very interesting live charts that you can see. They're broken down by county and have lots of information there. So I would definitely encourage people to dig into our website. There's a lot of things included. Each day, as we're discovering and getting more information, we're able to be putting more data up on that page.
Okay. So is there, in terms of the data, is it possible to go through a little bit of why there's been a kind of a fluctuation lately in some of the numbers reporting out? I know, again, you guys have your hands full and have had to make changes on your end, but if it's possible for our community of why some of those numbers might have changed in the last couple days or week.
So we are working really hard every day to make sure that we're reconciling that information to give the most accurate data. I think often we would potentially be criticized for changes, but I really think that it could be looked at as an effort to continually correct and make this better when we're wrong and have.
Meaghan brings up a really interesting point, which is we try to strive to get accurate as possible to everybody out there. And sometimes that means being a little delayed in regard to our data to make sure that we push out accurate data regarding both deaths as well as those cases that are in the hospital and in intensive care. But at the same time, some of the guidance from our federal government partners has been mercurial. And our state epidemiologists and our Bureau of Laboratories are the people who are literally staying on top of the federal guidance day in and day out. So our goal is to get you the best data possible in the shortest amount of time.
Yeah. Well, and we appreciate that you have to be flexible. We've all had to be flexible in different ways. So we'd rather have data that's right than not. And if that has fluctuations, then that absolutely makes sense. But I know it's been kind of confusing, but I think it's important, and I appreciate again you guys being on here to let us know that it's for a good reason, that everybody's figuring this out as we go along, and you guys are doing what you can to make sure that the numbers are as accurate as possible. So a couple questions, of course, that we want to ask about the availability of widespread testing, and if you know of any timelines on that. We are lucky that we have the Mohegan Sun Testing Center that started in Luzerne County last week. So we're happy about that. But as we know, going forward, we'll need more testing and beyond people that have the symptoms. Any sense of a timeline on when that might come online?
First and foremost, I really wanted to, I hope you can hear me okay.
Yeah.
I'm actually speaking to a mask today, so if I sound muffled, you'll understand why.
Yeah.
I really think you're bringing up the Mohegan Sun Testing Center. We were really trying to address a community need that has been made loud and clear to us, and I appreciated you bringing that up. Secondarily, but of no less important, I'll also let you know that the testing strategy, I believe that's one of the governor and the secretary's priorities. I have a feeling we're going to be seeing that in the very near future in regard to our future testing needs. Meaghan is smiling, which tells me I may be on the right track. But we are working on a testing strategy that is realistic and implementable. And I know that that's one of the governor's priorities. Meaghan, what's your question?
No, I know, and Dr. Lee will be speaking further on this topic at today's press conference, and then over the next several days there'll be more information put out, because that is one of the pillars of our reopening strategy. So yes, tune into the press conference and keep an eye out for any further info from us. And
would on the tracing end of things, would that include some plans for expanded tracing? And are there things that we should be doing here at the municipal level to prepare potentially for more tracing? Are there things that we need to be doing?
So in addition to testing, contact tracing is one of the pillars that the governor has identified along with the testing reopening. And we will be talking about that also today at the press conference and over the next several days, putting out our plans to discuss contact tracing in a little bit more detail. I don't know if it would be helpful. I think Ray might be able to explain exactly what contact tracing is.
Yeah.
I think that might be a helpful point.
So that was, I appreciate the segue, Meaghan. Thank you. I'm hoping everybody can still hear me okay. We're moving the computer back and forth between the two of us to make sure that we have good audio. And you're laughing. So I'll let you know that what to simplify contact tracing, it's basically looking at those people who are symptomatic and understanding how they became symptomatic, who they were exposed to, as well as the areas that they moved around in during that very critical time period. And what we're trying to accomplish with that is to A, see where the infection came from, but at the same time, B, understand the infection on those around them, those surrounding them. And as it sounds, it can actually be a somewhat laborious process in regard to tracking back where people were, their travel patterns, even potentially things like going to the corner grocery store and who they interacted with there. And we at the department have some pretty good experience with contact tracing. In my time here, we've actually had to contact trace several measles outbreaks in various areas of the Commonwealth. And clearly this is a bit of a different picture, but I want people to understand that our community health nurses, as well as our epidemiologists, have experience in contact tracing.
Wow. Yeah, I know it's a huge undertaking. So if there's anything that we should be doing at the municipal local level, we stand ready to do that. I know we get people that have written in to us and called in and said, I think I would be good at this, or I've done this before in a past life. Can we help? So I know we have people that would be able and willing to help if that were something that were something we could do at the local level here to supplement the effort and help the Department of Health reach those goals. We have a question about PPE for the nursing homes. I know you guys are in touch, like we talked about, the DOH through HAP, DOH the nursing homes and all the hospitals. But how's the PPE going for those elder care facilities?
So I would say from the very beginning of our particular response, we were utilizing what's called a push model, and we were pushing PPE. And when we talk about PPE, we're speaking about N95 masks. We're even speaking about gloves and gowns and even just face shields. But we were pushing a lot of that out to our acute care facilities. About a week ago, maybe a little bit more, we changed that just a little bit. We're allowing the hospitals to utilize their mutual aid agreement. So if there are hospitals in one area of the state that don't have enough PPE, and areas in the other part of the state that we put a lot of PPE to, they're moving some PPE back and forth. But what this has also allowed us to do is free up our resources to push PPE to long-term care facilities, to nursing homes, to personal care homes. And we've been undergoing that for about the last week. I will tell you, here in the Commonwealth, we do, as of right now, have a nice stock of N95 masks. But I will also let you know that just like we're seeing nationally, a bit of our dearth here is focused on hospital gowns and surgical masks. Mm-hmm. We have actually said that we don't consider that this is an insignificant issue to us. And we've actually gone as high as the White House to make sure that it's clear that we, like a lot of other states, are in need of it. We do expect to see these items as well, but I'll also let you know that the state consistently communicates with the federal government regarding the Strategic National Stockpile, which is where things just like this are stockpiled for events just like this. We've been planning, it's called the SNS, or Strategic National Stockpile, and we've been planning SNS push-out probably for the past 20 years. The issue right now is the fact that the Strategic National Stockpile, from what I understand, has been about 60 to 70% depleted, which means that the things that we're looking for are also things that other states are looking for. But we, as I said in the beginning, the nursing homes, the assisted living facilities, and the personal care homes are getting push-outs of PPE on a regular basis. Meaghan, did I leave anything else?
No, that was great. I do think that I want to highlight, I know Ray did, that congregate care settings are an absolute priority for us. We know that's a vulnerability, and it's something that our teams are keeping a very close eye on, watching the data along with our partners at the Department of Human Services to also regulate congregate care settings. So we have great partnerships with them and hope to continue to be able to support all of these facilities.
And I know, so we've been trying to, fill gaps on PPE where we can and try to support the nursing homes and long-term care facilities. But is there anything else that you think we could be doing here at the local level to supplement that guidance? As we we still are really in the middle of this with, I believe, some cases at our nursing homes.
No, I think everything that you're doing at the local level is exceptional. We spend a lot of time thanking our healthcare workers who absolutely deserve it, but I know that your staff and your emergency management teams are all working so hard day and night to help the community, to make sure everyone is getting what they need. So I think we can't speak highly enough of the work that our local governments are doing. It's really incredible to see how people are working together. Yeah,
I agree. I agree on that. So I know I don't have you guys forever. I did have a question about getting, as we look forward to getting some essential workers back to work that might have been quarantined or worried that they were exposed. So obviously the CDC recommends quarantining, but assuming that at a specific date and time, someone was directly exposed to a COVID positive person, how long after that COVID exposure will a COVID test show a positive result? For example, someone gets directly exposed to COVID today, assuming that he or she is tested within 24 hours of that direct exposure. Will that test be an accurate representation of whether the exposed person has or hasn't been infected by that specific exposure? Maybe a more detailed question at the end than I should.
That was a great question for our state epidemiologist.
Yeah.
But since I'm not that person, I will do my best. I will say that the incubation period fluctuates, which is why there was a while where we were not testing asymptomatic patients for that exact reason. Because
okay.
you may be negative today, tomorrow, and so we've been looking to test symptomatic patients. I will tell you that the incubation period fluctuates, which is also part of the rationale behind the CDC's guidance for self-quarantine. Because their thought process was that during that time period, you will become symptomatic and therefore determine whether you were exposed and or becoming symptomatic based on that exposure.
Got it.
So what you just touched on is actually probably one of the more difficult or intricate, epidemiological aspects of this particular infection, which is we've seen people become exposed and symptomatic almost immediately, and then we've seen some who just handle the infection a little bit differently, and they become symptomatic 48 to 72 hours later. And the CDC is trying to, make sure that we quarantine people until we can actually determine whether they'll become symptomatic or not.
Right. Okay, so the incubation period fluctuates. That's interesting to know. And then, of course, the more testing access and availability, the better we can fight that. So we know, and as a community, I think we know that this is going to be a long road, and we're patiently waiting. I know that the Department of Health, you guys are too, because some of this is a federal response. And I one more question that Deputy Secretary, you might not be able to answer because I know you're not in the bureau that does the nursing homes, but do you know when we might be able to get information about cases at nursing homes? I know if there might be a time when that information would be public, just to give more transparency for families of people, loved ones at nursing homes. Do you know that when some of that might be available, if at all?
So I think short answer to your question is we don't know.
Yeah.
This is something that we're talking about quite a bit internally, but also look at the federal level. So I think I'll leave it at that. Is get anyone further confused. So that's it. I don't know, and stay tuned for more information.
Yeah. Okay. Yeah, I mean, I realize we've talked a lot about this on my town halls. We know that there are a lot of there's a lot of legal ramifications for all of these questions. There's federal law, there's state law. We understand that, and we know that that's for the data, the broad public health data, and then also nursing homes, long-term care facilities, those are private entities. So understand that the rules aren't necessarily flexible on these things, and so we're hoping for that there. But we'll continue to ask questions at the local level to just advocate for more information broadly. And I think that we know we're seeing some of these structural deficiencies that are baked into our system that we'll certainly just be advocating for, which I think, should we hopefully never have to do this again, but we need to prepare for something and leave, at least leave a legacy of lessons learned and better structures going forward. That it'll help you guys, you do your job better too, I think, if there's some more flexibility baked into the system. So that's something that's my job. You guys have the actual public health pieces, some of the structural pieces I'll continue to work on. I so appreciate you, Deputy Secretary Barishansky, and Director Meaghan Abbott. Thank you guys so much for being here. At 2:00 today, you said will be a press conference with Dr. Levine and Governor Wolf.
I'll have some verbal time, and I can just send that over to your email. It's usually at 2:00.
Okay. Yeah. Great. Well, yeah. We'll Meaghan from my team can post that and make sure that we get that information out there. And just appreciate you guys being here, paying attention to Scranton. I know the city and the community. I know my team really appreciates you guys being on today. So thank you for taking time out of your very busy day.
Thank you. We appreciate it.
Thank you. Okay, that was very exciting. Yeah, Department of Health, I know they're working so very hard, and it was important for me. I've been talking with them, and they've been so helpful, and I know they're in touch with the hospitals, with the nursing homes, and I wanted them to say themselves to you in the community that that communication is happening. Doesn't mean that the virus stops because of that communication, but the people that need to be talking to each other are talking to each other, and at the city here, we continue to fill those gaps wherever we can, continue to try to get PPE where we can when asked. And I hope that gives you out there. I know that a lot of the answers to the questions just beg more questions. With we don't know yet on testing. We don't know yet what the contact tracing plans look like. Antibody tests. We're not there yet. I do think the Department of Health is working to do all these things truly in earnest to keep us all safe, and we'll continue to be in touch with them on a near daily basis. And updates, let me just check through, see if anything came through while we were on the call. Let's see. Okay. Yeah, so we do have, okay, looks like we jumped 21 cases since yesterday and 1 death. So the county is up to 934 cases. And a cumulative of 83 people that we've lost to the virus here in Lackawanna County. So we still are in this. I can't believe it's May and we're still here, but we are. And I know that we're all anxiously awaiting the governor's press conference today and some decisions, reopening some portions of our economy. As we've talked about during these town halls, it's, I believe, my job and that of the other officials here in Lackawanna County in our region to also work at the local level with our hospitals, with our infectious disease specialists, with our business leaders, with our colleges, our school districts, to make sure that our local solutions match, local needs match the solutions at the state level. So I don't want to take the precautions off prematurely. We're at 934 cases that we've had of this virus. So I don't want us to take any precautions off too soon. And I don't think the governor will do that either. We did here in the city of Scranton, we're extending the state of emergency until May 15th. Lackawanna County is also through May 15th. I wanted to do that to match the county, but also to just give a little bit of certainty here on May 1st that I think we've got another couple weeks at least of the current state of affairs where city county buildings are not open, and we're absolutely still really taking all the precautions. I don't think the masks the masks and the social distancing is going away anytime soon. I know that in speaking with leaders around the area, everybody's trying to figure out plans for summer, plans for the fall, and we're trying to plan for those things. I'd say before any of those announcements are made, keep in mind that in order to do something this summer, a lot of institutions, private, public, what have you, have to plan now, buy materials now, advertise things now, hire people now in order to be open in the summer. So again, it doesn't, really doesn't matter what you're thinking about. There's a lot of planning that has to either happen now or not. And I know at the city level, when we're looking at things, I have to look at the budget and think, well, maybe there's something we want to do this summer, but I don't have either the ability or the funds to do it right now. So maybe we won't necessarily be in the thick of this thing in the summer, but maybe there's something that won't be going on this summer as planned because we've been in this disruption phase here in the spring. So it's important to keep that in mind also as the governor speaks, I think, and as people entities make decisions about the fall vis-a-vis colleges, for example. It's not just what is the world going to look like on October 1st. It's what has the world looked like as institutions have tried to plan for that moment. So I think that's something we all have to do together, is remind ourselves that today to not open something doesn't mean that we're going to be in the thick of this thing all the way through the fall, but it might mean that the planning has been disrupted or the funding has been disrupted. So, just like all of this, we're in this together, looking at all these things, and I ask that keeps those types of things in mind, those processes in mind. So let's see, what other updates do we have today? The testing center is still open at Mohegan Sun, and they are testing eligible healthcare workers and first responders and symptomatic patients over 60. Patients do not need a doctor's prescription to be tested, but you do need to pre-register online at health.pa.gov. Call 877-PA-HEALTH if you have symptoms or questions. That's also the Department of Health, so healthpa.gov or 877-PA-HEALTH. And the Geisinger Nurse Triage line, you can also call there if you're experiencing symptoms, 284-3657. I wanted to go over again the updated CDC guidance for symptoms of COVID-19. So there's cough, shortness of breath, difficulty breathing, and then at least 2 of the following: fever, chills, repeated shaking, muscle pain, headache, sore throat, new loss of taste or smell. So those are important to know that that updated guidance. And again, you still need to call ahead. You can't just show up. Rite Aid is also doing a testing center down in Plains. So we continue to try to get more testing. Obviously, we just talked to the Department of Health here live, and they're still working on it themselves. But that is absolutely necessary. Let's see. There's one other update here that I'm trying to get. We'll get back to that. Okay. So emergency. So in terms of the emergency declaration, extended to May 15th. The governor did restart construction statewide here as of May 1st. So you might see some folks on construction sites. They do need to be social distancing, and unless the safety of the workers requires deviation from that, lifting things and that they'll be, obviously wash their hands and have their equipment clean and sanitized, and also wear masks. That's, the construction is open, but it's still on a bit of a modified basis. All right, I know we can kind of hop to questions in a second here. I just wanted to remind people on a couple of things. Register to vote, votespa.com. Register to vote or mail, ask to receive your ballot in the mail. June 2nd is the primary. It's only a month away. I don't want to be standing in line to vote. Actually, I won't be voting because I am an independent and I don't get to vote in the primary. That's for a town hall in the future. I don't think that's right. I think we should have open primaries. But votespa.com, register to vote, and you got to register to vote by May 18th, and you have to sign up to receive your mail-in ballot by May 26th. I would say don't wait till then. Do it today. Election's only a month away. Get on votespa.com or call the Lackawanna County Elections Bureau at 963-6737. Again, 963-6737. The census is also already live. Please, please, please watch the census. It is thousands of dollars per person that we lose in this community if you don't count yourself. Census doesn't run itself. It doesn't just count you. There's no drone that goes over and counts all the people. There's no Google Earth that counts you for us. You have to do it yourself. So please, my20census.gov. Go there, respond to the census, help us get you the funds that in our community that we desperately need, especially after all this. And remember that the census is for 10 years. It's not just for a year, it's for 10 years. So we could be sitting here talking in the year 2028, and we will be looking at a budget based on federal dollars that came in from the census and from your actions today. So please respond to the census. So with that, I'll take questions. Let me just get those. Thanks guys for hanging with me. Okay, so Tom asked, as construction resumes today, how can we be sure that the health and safety of these workers is still executed on the construction sites? So that's where we're asking the managers, the business owners of these construction companies to be good stewards for themselves, for their workers, and for those around them, and make sure that they're following those. If you have questions, you can email us or call, and we can get you the updated health and safety information. I know our code enforcement department has been proactively sending out that updated CDC guidance with any of its licenses and permits in the last couple months, but we can certainly send those out to you again. So if you want to shoot an email to scranton311@scrantonpa.gov, or you can call our main line. We'll connect you into code enforcement. That's 3484101. Excuse me. Just take a second. So a question about DPW recycling cans. We aren't giving those out right now. We will assess that as we look to the governor's orders. And like I said, our state of emergency is through May 15th. So potentially we can make a change to that in a couple of weeks and have those recycling cans available for you at DPW. But at this point, we haven't wanted the public, for the public and for the city employees, haven't wanted the public coming down to the DPW. Tracy asks, if I live in an apartment complex and other residents or employees are not wearing masks or staying socially distant, what should I do? Tracy, I would ask your neighbors, say, that you can say that there's a governor's order to wear masks, and ask them to do that. It's out of respect for our neighbors that we do that. So I think you can absolutely do that if you feel comfortable talking with them. If you're sincerely concerned about public health in your apartment complex, call us or email us, and we can try to do a kind of a wellness check. So it depends on the degree to which you're worried and the type of conditions at the residence that you're at. So feel free to give us a call. We'll try to help if we can. Or if the governor ordered it, this is a pandemic. This is a special time. People should be wearing those masks. They should be respectful of that request that you're making of them. You can also tell them that the mayor said you could say that. Iris asks, We sent in a fee for handicap signs. Any date when we will be receiving stickers? Iris, we'll check in on that. I think it's one of those items that we may be, we might be a little bit behind on given that we've had to work mostly remotely. So we'll make a note of that and try to sort that out. You're welcome to email or call us if you want to give us more specifics on that. And then Kayla asked, when will the refuse bill be mailed out? We got those changes. We worked with City Council. Those changes are going through. I'm actually signing that document today. So those changes will be made and the bills will be mailed out very, very shortly. That the period that period of time to be able to pay your garbage bill and get that discount is now moved to June 15th. So now you've got till June 15th, not May 31st, but June 15th to get that discount. And remember, you can pay that online, and we really encourage everybody to use that remote service to pay the bills online so that you don't have to come down. And guess what? City Hall's not open anyway, so can't come pay the refuse bill in person right now. So it's best to just pay it online. We will be mailing them out very soon. You can go online and pay that bill now. As you know, it's $300. There's currently a 10% discount, and that discount is until June 15th. So let me get to the other questions. Okay. So Pat asked about dog groomers. Pat, I don't know. That's one maybe to watch the governor's press conference today. Perhaps he'll have a little bit more information about that. I imagine that's something that he'll talk about, maybe not today, but in the coming weeks. Let's see. Yeah, Anne-Marie asked, can we have testing here for the ones with no symptoms? Some people don't have cars to get to Mohegan. And that's absolutely true. And that's why I had the Department of Health on today to ask that very let me just scroll up again to that Mohegan information. So yeah, you still have to have symptoms to go to Mohegan. That's what we're waiting for, is no symptoms testing. Throughout the country, we're waiting for that. And that's difficult. So we really need that for so many reasons. We all know that we need more testing in order to safely open up our community again. So Mohegan is still not no symptoms. In order to get tested at Mohegan or anywhere at one of the hospitals, you still need to call that number, two different numbers, either PA Health 187 PA Health or Geisinger at 284-3657. There is the expanded list of symptoms, but we're still unfortunately not getting tested for people with no symptoms. Okay, Sherry is asking, do you have more information on Mart's buses to Philadelphia? I've been in touch with the owners at Mart's, and they are looking at potentially running a route into and from Scranton and Philadelphia starting on May 11th. They're not sure that that's the date that they'll go with. That's a possibility. I am in touch with them about that. They've been about working with me and other elected officials around the region for that. I know they're working hard on the cleaning, sanitation, and health procedures for their vehicles, and they'll have more on that. And I will, I'll continue to be in touch with them to make sure that it's something that works for our community. Okay, so Mike is asking, there are massive amounts of roofs and home improvement being done without permits. Well, that's interesting, Mike. So let me, let's just give me 1 second, please. Let me get you I should have it memorized, our code enforcement department number. I will get that to you in just a second, Mike. Yeah, please give a call and let them know that shouldn't be happening. Code enforcement open here for a reason. So that should be just up in a second. And yeah, we'll get that sorted out. And the number is 348-4193. Again, our code enforcement here at the city, 348-4193. We are working really hard to make that department work better for all of you. It's been a bit of an adventure so far here in my tenure as we've had this COVID situation, but actually in some ways it's helped accelerate some of the reforms that we want to make, making permitting online, those types of things. It's actually helped us be more efficient and really put that into hyperdrive. But Mike, that number again, it's 348-4193. And go ahead and give code enforcement a call to let them know what you're seeing. And yes, Larry, you can pay garbage fee when you're ready. You can go to our website and do that. And let's see. At what time will we feel safe to visit grandkids? Even though today we are negative, I'm not sure. I know that I sure am looking forward to introducing my daughter to her cousins. She said for her, she thinks there are only 3 people in the world: my husband, myself, and my mother. She's in for a beautiful, beautiful world where she realizes that it's not just the 3 of us. She seems to like us a lot, but it'll be fun for her to realize that there's more out there. So yeah, Norma, we'll be following the governor's guidance, but also looking at it here at the local level so that we can hopefully get back to our families soon. Alexis is asking about the city tax deadline, the property tax deadline. We are looking at that. We are working with the school district on that. We will not move unilaterally without the school district on property, or at least without really, really drilling down with them what it looks like. So the property taxes are a major driver of revenue for the school district and for the city. So I know the county, waived their delinquent fees for the rest of the year. We're looking at that, and we'll try to turn that around as soon as we can. But it's pretty complicated here in the city and for the school district, as the portion of our budget is large, and especially at the school district, that's a very large portion. So we're trying to get that balance right between our services here for the public and our revenue streams, our cash flow. Let's see, do I have any more? John is asking, is there any guidance regarding those who have had COVID? Are they less likely to become reinfected? And I think the answer is no one knows. I know that all the reports that's still a question mark. We just don't know how the virus behaves yet. So that's where we have to make science-based, data-driven decisions and listen to those infectious disease specialists, the CDC, and our hospitals, our healthcare institutions to figure out what that looks like. And in absence of an answer, how do we move forward with that? So it's a good question, John. It's one that no one knows. Let's see. I'm trying to down here on Facebook. Thanks again for everyone who's writing. Let's see. Larry's on voice text, everybody. So yeah. Oh, I love this. I really love this. I appreciate you guys so much. It really is helpful. Judy, I'm not understanding your question about the number of cases. So I did want to reiterate that we have zip code data, but not Scranton data. So the number of cases in Scranton by zip code that's shared. Some of those zip codes are shared with Dixon City and with Dunmore. So it's not precise, and that's part of the problem with the data situation. Is we need more data. We need to know the ages of people that have succumbed to this terrible virus. We need to know the ages of people who have had it and recovered. We need the number of people who have recovered. We need to know the timelines of not just the aggregate number of cases, but when people have had it, when people have recovered from it. So we really have a long way to go. It is frustrating on a lot of levels. It's no one person or one entity's fault, but it's a huge structural flaw in the way that we run public health here in Pennsylvania. And we'll be making sure that we fix that problem going forward, at least here in Scranton and Lackawanna County, and trying to get a city or county or hybrid health department up and rolling. In this near term right now, though, we don't have all the data we would want, and that's difficult, and it's going to become more difficult. I think from a public policy perspective, we are at the beginning of what's hard. It's funny, there's a siren going outside of my office right now. The emergency piece of this, arguably, it's kind of black and white. The decisions that we've had to make starting in mid-March, even early March, you think about, okay, there's a pandemic, we got to close City Hall. We just have to do it, got to do it. There's a lot that goes into that decision and making sure we can still get services to you. But it wasn't, the decision of doing it wasn't actually that hard because of what we were facing. As we then turn to this kind of next phase, the governor's got his press conference in an hour. Like the job of figuring out how to phase back in and what things look like in the future is really where I think the gray area is, and where we're really going to have to make difficult decisions with a lack of information, and that's going to be hard. It really is going to be hard, and I appreciate everybody out there continuing to communicate with us so that we know what's on your mind and how you feel about these things. Okay, let's see. Okay, Debbie's been trying to reach out to animal control. Okay, so Debbie, if you wouldn't mind emailing our Scranton 311 at scrantonpa.gov with your specific case, that would be really helpful. Okay. Okay. I like Debbie's offer to volunteer. That's something we can talk about. Thank you. Yeah, and yep, there's no health department in the county or the city. Not uncommon in Pennsylvania. There's only 6 counties and 4 cities that have health departments, but we're seeing that is a problem across the state. I was on a call that included the mayor of Williamsport. He and I talk a lot, and that's really handicaps us in a lot of ways. So we're going to work hard to fix that. In the meantime, I'm hoping that the governor and the state legislature can work on some of those legal pieces to allow some more data to us. We don't have enough, and we really need it. So we'll continue to advocate for that. I'm going to spend some time this weekend advocating at the federal level to have the next package of relief that comes from Congress include state and local governments. That's a big piece of what needs to happen, and that would be to mirror the PPP on the nonprofit and business side, which I want to talk about too before we go. Our businesses are really struggling. We are working hard to stand up a local small business relief fund. We're trying to get that off the ground. I'm sorry that it's taken a little longer than I'd like it to, but we are hoping to do that. I know that our business owners are hurting, especially those that weren't able to access the PPP. And I know that the Payroll Protection Plan program, I know that even if you get the money, it's very hard to figure out how to spend it down. The rules of how to spend the money that you got from the federal government are actually really murky themselves. So we all have a long way to go. It's going to be a long road. I'm hoping that road is a little bit more clear in the coming weeks while we work and see what Governor Wolf and his colleagues, again, he's working with the governors all around the region, Connecticut, New Jersey, New York. But there's that effort, and then there's the local effort. You guys are so much of this local effort. We could do what we need to do on the ground here in Scranton as a community, and I'm so appreciative for all of you for sticking together. It's just tremendous to see how we do stick together. With that, let me have one more plug for the fundraiser for food for our neighbors, safdn.org, Heart of Scranton. until 7 o'clock tonight. We've made $62,000. We can get up to $100,000 that will be matched dollar for dollar to get up to $200,000. That's a lot of food. That's a lot of meals that Meals on Wheels, Friends of the Poor, and the food bank can provide for Scranton residents. This all goes directly to Scranton residents. It's a really big deal. I'm so grateful for everyone who has given. If you're able to, just hop on right now, once we sign off, even $3, $6, I think $6 is how much buys a meal for a senior for Meals on Wheels. If you can spare the $6, please go on and do it. It really helps, and at a time when we really need to make sure that we're feeding our neighbors, as they might have lost a job and never expected to be in this situation. As we all know, anybody, any household could have a change of situation, and we have to help each other right now. And I'll continue doing everything I can here at the city. I appreciate all of my team, the city employees, our first responders, our sanitation and public works guys that are out there. That's always reminds me not to litter. Please don't litter. I don't know how the weather's going to be this weekend. I don't have time to go to that app on my phone, but if it's nice and you're outside, please wear a mask. Please don't litter. And thanks, of course, to all of the healthcare workers that are out there on the front lines. I appreciate you all. I hope that you can have an enjoyable weekend, and thanks for tuning in.